This week's blog is going to revolve around a new article that came out on Observer this week and graciously shared via one of my favorite colleagues with Benton Chiropractic in Lampasas, Texas, Dr. Craig Benton. Thank you, sir. The article was written by Ken Blaker, published on November 16, 2017, and called Bandaging Veterans' Pain with Opioids is Proving Deadly. Must Stop. As a portal of entry practitioner, I believe that any chiropractor will quickly agree that the veterans we see are hurt. And I don't mean just a little hurt. I have a couple of patients that have fallen out of helicopters, for example. So that's the kind of hurt I'm referring to. These men and women have not only risked their lives, they in many cases have ruined their lives. In the article, Mr. Blaker mentions an overburdened VA health system. I cannot tell you how many times I've mentioned getting x-rays at the VA, or how many times I've said something similar to, have you seen your doctor at the VA about this yet? And these types of comments and questions are almost always met with an eye roll and a dismissive comment. Some of them I can repeat, and some of them I can't. They don't like going to the VA because they don't like waiting forever to be seen, and they don't normally like the treatment they receive when they finally do get to see the doctor. Combine the increased trauma and stress they put on their body with sometimes very traumatic experiences related to combat and service, and you have a volatile combination. It's easy to see why our veterans are at an increased risk of abusing and overdosing on opioids. Now that the United States is in an opioid epidemic, we had all better start paying close attention to this group of people, especially considering the fact that this article is quoted as saying veterans succumb to opioid overdose-related deaths at twice the rate of the general population. Wow, that's pretty significant, wouldn't you say? So, Mr. Blaker has a comment in this article that I will likely carry with me for the rest of my career. The quote is, "Patients are entitled to the best treatments that do the least harm." So how lovely is that? It's pretty perfect when we're discussing weighing the risk versus reward ratios for chiropractic protocols and medical protocols in regards to pretty uncomplicated neuromusculoskeletal complaints. As the article goes on to discuss, there's a wave in the medical community as a result of the opioid epidemic. The wave is more and more in favor of not only making it harder to get a hold of opioids, but also identifying alternative non-pharmacological treatments for pain. The current president of Parker College in Dallas and former chiropractor to the U.S. Capitol in Washington, D.C. was quoted in the article as saying, "Non-pharmaceutical approaches to pain should always precede pharmaceutical interventions. Chiropractic, acupuncture, physiotherapy, exercise, and psychosocial counseling are all preferable starting points in treating pain." That was a quote from Dr. William Morgan. So Dr. Morgan is standing on tall shoulders when he makes this statement. As I've discussed recently on my blog, the American College of Physicians and the American Medical Association have both recently published papers and articles supporting the use of chiropractic, massage, and acupuncture first for chronic and low back pain before turning to any anti-inflammatory such as ibuprofen, Tylenol, or aspirin. One more time, just for good measure, two of the biggest entities in the American medical profession now recommend seeking help from a chiropractor, massage therapist, and/or an acupuncturist before taking any pills of any kind. So, just another reason to call a chiropractor today. Research and clinical experience shows that in about 80 to 90% of headaches, neck pain, and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, it's more cost effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on the part of you, the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising the general overall level of health. Please feel free to leave a comment, tell me your thoughts. I'd love to hear what you think, and please share the video. We can't make a difference without your help. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Yes, we're on all of them. Also, be sure to subscribe to our YouTube channel. The link is in the description, or just hit the subscribe button below. At the very least, can we talk you into giving us a thumbs up on this video? A gesture that simple really does help us get in front of more and more people looking for this kind of information. Till next time, I am Dr. Jeff Williams with Creekstone in Amarillo, Texas. Thanks.